Hi all, welcome back to Medverse. Today we will dive deep into one of the most common endocrine disorder you will face in both clinics and exam, which is hypothyroidism. So, what exactly is hypothyroidism? It is a condition where the thyroid gland fails to produce enough T3 and T4 hormones, leading to a slowing down of metabolism throughout the body. Think of the thyroid as your body's accelerator. When it slows down, every system in the body works sluggishly. We classify hypothyroidism into three main types: primary, secondary, and tertiary. Primary, when the problem is within the thyroid gland itself; secondary, when the pituitary fails to produce enough TSH; and tertiary, when the hypothalamus doesn't produce enough TRH. Among these, primary hypothyroidism is the most common one. Now, causes vary based on geography and etiology. Globally, iodine deficiency remains the most common cause. But in developed countries, autoimmune destruction of the thyroid, known as Hashimoto thyroiditis, leads the list. Other causes include thyroid surgery, radioiodine therapy, and drugs like amiodarone and lithium. Coming to pathophysiology, when thyroid hormone level fall, the basal metabolic rate drops. The body tries to compensate by increasing the TSH secretion from the pituitary. Over time, the thyroid gland may enlarge, forming a goiter. Reduced thyroid hormone also alter the lipid metabolism, hence cholesterol levels rise in hypothyroid patients. Now let's talk about how these patients present. Symptoms develop gradually. Patients often come complaining of tiredness, weight gain despite poor appetite, cold intolerance, dry skin, and hair loss. Their face looks puffy, especially around their eyes, and that's called periorbital edema. Voice becomes slow and hoarse, and speech may sound thick due to myxedematic swelling of tongue. On examination, you will find bradycardia, delayed angle reflex relaxation, and dry, rough skin. In severe untreated cases, the patient may develop life-threatening myxedema coma. Coming to investigation, TSH is the most sensitive test. In primary hypothyroidism, TSH increases, T3 and T4 comes down. In secondary hypothyroidism, both TSH, T3 and T4 comes down. Anti-TPO antibodies are positive in Hashimoto thyroiditis. Always remember to check the thyroid profile since hypothyroidism commonly causes hypercholesterolemia. Treatment is hormone replacement using levothyroxine, a synthetic T4 preparation. It starts at a lower dose, typically 25 to 50 microgram per day, and titrated based on the TSH level, which are monitored every 6 to 8 weeks. Once stabilized, patients usually require lifelong therapy. For myxedema coma, IV levothyroxine with hydrocortisone is life-saving along with supportive measures like warming and correction of electrolytes. Let's recall some high-yield facts. The most common cause worldwide is iodine deficiency. Most common cause in developed countries is Hashimoto thyroiditis. Most sensitive test is TSH. Drug that cause hypothyroidism is amiodarone and lithium. And the most severe form is known as myxedema coma. To summarize the symptoms, remember the mnemonic myxedema. M for memory loss, Y yawning or fatigue, X for extra weight gain, E edema, D dry skin, E expressionless face, M menstrual disturbance, A alopecia, which is easy to recall and perfect for quick revision. So in short, low T3 and T4, high TSH, slow metabolism, fatigue, weight gain and dry skin, and treatment with levothyroxine. That's hypothyroidism simplified. That's wrap up our session on hypothyroidism made easy. If you enjoy this class, make sure to hit like, share it with your med friends, and subscribe to Medverse for more simplified medicine. Until next time, keep learning, keep healing, and stay curious. Thank you.